Welcome back to Healthcare for Teens, a channel dedicated to helping teenagers understand more about the different areas of healthcare. Today we have with us Dr. Vladimir Muzykantov, a professor of pharmacology at the University of Pennsylvania's Perelman School of Medicine. Dr. Muzykantov, thank you so much for being here with us today.
Sure, my pleasure. Thank you. And thank you for doing this, Abraham. I think that the, to publicize science and scientific research and maybe even scientists is very helpful.
I'd like to begin this interview by asking, why did you decide to go into medicine as opposed to other industries?
Well, it was not very much of my deliberate decision because I was born in a family of fifth generation of physicians and medical researchers in Moscow. My father of my grandfather was a surgeon. My grandfather was a professor of physiology. My grandmother was a therapy internist. My dad and mom went to the same Moscow medical school, and they become scientists, researchers. My sister is a physician too. My niece is a physician. So I was sort of destined to go to the medicine because there was so much of the spirit in the family.
Of all the medical professions, what made you choose pharmacology rather than cardiology or radiology or something else?
Well, that's a very interesting question. First, I would not say that I deliberately or precisely choose pharmacology. Uh, in fact, pharmacology is more of my second discipline, which I work on in University of Pennsylvania. I was driven by general biomedical science of drug delivery, which is much more diverse and inclusive than just pharmacology. You need to know the main systems of the organism, blood, circulation, tissues, how the materials go there. And of course, it is very multifaceted discipline. It includes also elements, large elements of the chemistry, polymeric chemistry, lipid chemistry to make the carriers for the drugs, etc. So I would say that I was not attracted to any specific medical disciplines to treat patients. Maybe because I was more inclined to science rather than to practice medicine. And that allowed me to drift from one aspect to another. In 40 years of this exploration, did some findings which were very interesting and are.
What does a day at work look like for you?
Well, it's um, well, first of all, I usually take a day or two working at home because post-COVID, COVID was a very traumatic for the society, certainly, but it also was um, sort of discovering for us Zoom and other features for the remote and distance commuting and working. Um, and so when I work at home, I just sit in front of my computer for the whole day with small interruptions for a walk. When I go to work, it also depends because in most cases I have some administrative responsibilities to carry on. In the spring semester, I teach, I direct a course, and then, of course, my lab, my main joy is working with my lab. Also, I don't work in the lab for decades now myself. I was always very clumsy and not very well coordinated, or my reaction is not good. Uh, so the younger and more dexterous people in the lab do main experiments, and twice a week we have a lab meeting, which is also joined by the lab of my former postdoc, who is now an independent clinical faculty. And we discuss things, we discuss findings, difficulties. Very often they are puzzling, and you have to have this appetite and sort of inclination to solve puzzles.
What research have you conducted in the past?
Well, perhaps all 40 years of my research career, I was doing research on mostly biotherapeutics, on proteins or nucleic acids or other natural molecules or even cells, which we modified in a way that would direct their uptake or the accumulation in the body and subsequently the effect to certain cells, tissues, organs, for example, like in the brain. When somebody has a stroke and the blood supply in the brain becomes very scarce, and this is a very dangerous condition, we have drugs which can help, but they need to be delivered to the site of injury. That's my work, and you cannot do this even if you have very deep knowledge of just one discipline. That's why maybe my evolution as a scientist took so much time and decades, because you have to learn most of this on the spot, on the job. There's no discipline which would teach you in the university, especially 40 years ago in Moscow. So all this very empirical, and it's unpredictable, because what I try to do is to modify drugs or drug carrier elements in a way that they would become more affin to certain cells or tissue components in a certain organ. And in some cases, we guess correctly. We think that the molecule of certain type expressed on the surface of these cells, target cells, it indeed can serve as a target. But very often we miss. And in some cases, we even don't know what is the mechanism or particular molecule or cell type which represents the fortuitous entry to the organ or site of interest.
What's the significance of conducting research, and why is it so valuable?
Well, there are several aspects to this question. The first aspect is your personal significance and your personal gain. And second is the society. I can't say much about the society because on one hand, it's sort of obvious. On the other hand, it's not obvious enough even for our country, for the United States, to pursue the discourse which would be respectful to the science, to scientists. Even in this country, we have a significant sector of a population which sort of doesn't believe in science, anti-vaxxers, etc. So I can't comment, or I don't like to dwell onto this societal significance or implications of science. I can only say that for a scientist itself, like for me, science is the best occupation you can imagine, because it is hellishly competitive, but it's very gratifying. It's extremely tiring, but it's very enticing, and very interesting. Essentially, you do what you want to do, and for the money of your university or the NIH or other funding agency, and you go to work every day to do what you want. I don't know much of the other professions which do the same, have a luxury of this. In addition, it's very competitive and very self-cultured profession. It's almost like professional sport. You always need to be the best. You always need to be the best in the world, or Olympic Games. The same in science. You need to be the best in your area. And also, it is maybe not as physically demanding as in sports, but it's very difficult. In contrast to the sports, however, your career is ended by 20s, 25, maybe 30s. What else? What's next? So many young sportsmen have a crisis after they leave the sports. In science, it's your life. You can be active and a relatively successful scientist. I mean, I'm 66, but at 80, it has longevity of this profession, and of course, it offers you the communications and friendship with very interesting people, usually nice and usually well educated and very kind and very interesting. It also gives you some self respect and respect from the other people. It gives you travel. I mean, gosh, I saw so many countries and interesting places because I was traveling to the conferences, to give talks, to see the colleagues. It gives you the feeling of relatedness, belonging, and sometimes even the feeling of partition to the something very big. It might be a false feeling. We all are humans. We may make mistakes, but it's a quite motivational thing.
What advice do you have for aspiring teenagers hoping to go into the healthcare industry and become medical professionals like yourself?
Well, with a note that I'm not a medical professional, purely speaking, I'm a scientist, I'm a researcher. I don't treat patients. And I don't really know what to say to young fellows who are contemplating medical route. To be a physician, it's extremely demanding. It's very difficult to get to this point. Physicians are selected and they are trained in a way like astronauts are, sort of. And if you don't feel that medicine, practical medicine, is a very important magnet for you, it may be maybe better not to try to force yourself into this. In the science, it's different. Science gives you lots of opportunities to pick and choose, even not just the condition of experiments or direction of specific project. It allows you to pick and choose the whole topic, the area of science. For example, you can study evolutionary biology of certain organ system or disease, or you can study the effect of environment of certain geographical conditions to the certain health problems, such as anemia induced by hemolytic anemia induced by the malaria and other pathologies of the red blood cells. They have very important local traits in the areas where they are common. What I would say to young folks is do what makes you interested. Don't do what you may see as important from the standpoint of other people. You live your own life. You should be doing what is interesting, what is important for you. And don't expect huge outcomes. Don't expect, because they will be coming. They are inevitable, but you don't know what they are. And not be put off by errors, by results which don't address and don't correspond to your hypothesis. In fact, my experience is that the most interesting results are results which do not correspond, do not answer to your hypothesis, because then you have a chance to unearth something new.
That's it for this video. And Dr. Muzykantov, thank you so much for being here with us today.